Dr. Mike Greiwe, a shoulder, elbow, and sports medicine specialist at Commonwealth Orthopedic Centers, and I wanted to talk to you today about proximal humerus fractures. So proximal humerus fractures account for about 5% of all fractures, and they can be very, very debilitating, very painful. I see patients in the office every day with this particular problem, and usually it happens due to a fall in most patients who are a little bit older. And in younger patients, it typically happens from a pretty significant violent mechanism, such as a car accident, a bike wreck, a skiing injury, things of that nature. People want to know kind of how to treat these injuries, and this is what I'd like to talk to you about today. So when people come with proximal humerus fractures, this particular injury occurs due to a disruption in the bone at the top part of the shoulder, so right in this area. And the proximal humerus is actually attached to the shoulder socket. And that particular injury can be very, very painful and difficult because patients can't really move the shoulder well without getting a lot of pain. And when they do that, the pain is so severe they may not want to move the shoulder very well. So what we typically do is we'll get x-rays and we'll make sure that the shoulder does not need to be treated surgically. Occasionally these particular fractures need to be treated surgically if the bone is displaced a significant degree. When we do consider surgery, it can be any variety of surgery. Sometimes pinning can work. Sometimes we need to do shoulder replacements, and occasionally we may need to put a plate and screw in to fix this type of fracture. Many times patients just need to be treated in a sling, and obviously that's the most ideal scenario, but if you do have to have surgery, we would do that fairly quickly because you don't want to let the bones heal and have the position be wrong from the beginning. So in terms of treatment, from a sling standpoint, we really use ice, we use slings, and then we start physical therapy once things start to improve from a healing standpoint. If surgery is needed, we then will wait about a week or two and we'll start physical therapy from that standpoint. Recovery from these injuries can be very difficult, very challenging. It may take you even 6 months to 9 months to actually recover completely. So hopefully that's given you a good picture into proximal humerus fractures. Please contact us at www.orthonky.com if you have any further questions. I'm Mike Greiwe. I'm a shoulder, elbow, sports medicine specialist at Commonwealth Orthopedic Centers. Thanks.